a quiet hospital in Urmia, Iran, there's a sad story about babies born with unusual problems. One of these problems is called Cyclopia. It's where the baby's face doesn't develop normally. Instead of having two separate eyes, there's either one big eye or two eyes that are very close together. This often leads to stillbirth or the baby dying shortly after birth. There's a very specific case at hand, a 37-week-old baby girl born in Mazad Hospital. She weighed 2,300 grams, was 43 centimeters tall, had a head circumference of 31 centimeters. She was born normally to a 44-year-old mother, but when doctors checked her, they found something very strange. She had one eye and a 4-centimeter thing on her forehead. She did not have a nose, but her outer ears were normal. There was no cleft lip or palate. Sadly, the baby passed away just 13 hours after being born. There's another problem here called holoprosencephaly that often happens with babies who have facial issues. It's a brain problem where the baby's forebrain does not split into two parts like it should. This causes a single-lobed brain and some facial features that just don't look normal. Holoprosencephaly comes in three types: alobar, semilobar, and lobar. In alobar, the brain doesn't split at all. This causes serious facial issues. Semilobar is a bit less severe because of the brain partly splitting, and lobar is the least severe with almost normal brain separation but some small issues. Some babies born with milder holoprosencephaly have small facial quirks like a tiny head, eyes too close together, or a flat nose and strange front teeth. Cleft lip is the least serious, and cyclopia is the worst, where the baby has one eye field and a nose that might even be above the eye. If a family has a baby with cyclopia, they should warn close family members about the higher risk of having babies with these problems. Cyclopia often leads to stillbirth because the baby's brain and body don't grow normally. Doctors can find this problem early using ultrasound while the baby is still in the mommy's belly. To help babies and moms dealing with this problem, it's important to find it early during pregnancy and take care of it the best way possible. Some babies might need special care immediately after birth. In this tough situation, the message is clear. Let's use our knowledge as a collective humanity to help these families and pay special attention to those in need. These are Interesting Things with JC.